Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by SpaMedica. Hello and welcome, Dr. Stephen Mulholland here at Plastic Surgery Talk for our latest podcast on intimacy and breast augmentation. Breast augmentation, extremely popular, the #1 cosmetic plastic surgery procedure that women do. Now, when changing something so intimate and personal as breast shape, size, and volume, it becomes a very personal and intimate decision. And there's various forms of intimacy during this relationship of a patient, a female patient acquiring breast implants. First of all, the comfort with the volume and projection. What is it going to look like? How is it going to appear to people both in and out of clothes? One of the most important tools in a modern day plastic surgery practice is empowering women to select the right implant size and shape for them. So using products like the VECTRA 3D, the most well-known and the most high-tech 3D imaging system for patients to come into my office, to have a sense of what kind of volume and projection they want to create, but not really being sure, and then having the safety and security of knowing through 3D imaging what certain sizes and certain shapes will do to their figure, shape, and form. So, like trying on a dress, you want to make sure it fits your body. You have a sense of beauty in your mind as a female patient on what you think you want to project and how you want to look, and the kind of impressions and feedback and self-image that you're going to create. You'll want to be able to do 3D imaging to pick just the right size and shape of breast for you. Now, once you pick those implants and the operation has gone well and you've got your new breasts, it usually takes between 6 and 12 weeks for the implants to drop and soften. During that first 3 to 4 months, you're going to be a little bit more self-conscious because you're not used to having implantable devices giving your figure, shape, and form. They might look good, but you're not quite used to them. You haven't internalized these new devices, the implants, in your sense, your super id of yourself and how you appear. And so it takes about a good 3 to 4 months for the implants to drop, to soften, to feel mobile, to feel natural. And by the time you start to get that natural feel to the implants, they really become quite remarkable. The new cohesive gel implants with the responsive gel have the ability to respond to your position in space. As you stand, the implants will look teardropped. As you lie down, the implants will become round. They feel very soft, particularly if you have a little bit of glandular tissue or it's under the muscle, under the muscle plane. They feel very soft, very natural. In fact, most guys, if they aren't told, when they're feeling a female's breast that's got a cohesive gel augment, they can't tell that it's been augmented. It feels that natural. So during moments of intimacy, when you're closest with your partner, a partner-to-be, or an existing partner, the breast implants will become integrated into your sense of self. They won't feel foreign. They won't tend to feel unnatural. Certainly not like the saline implants of 15 or 20 years ago that really felt quite unnatural. The new cohesive gel, responsive gummy bear implants placed in the right pocket with the small incision will leave you feeling almost like they're your natural breasts, the breasts that were genetically meant to be for you, and you got to select their size and shape. And so any form of intimacy that's a manageable, high impact or low impact, lying on your tummy, a partner lying on you, these implants are very resilient. They are made to last for the rest of your life, so you will be unable, in all practical purposes, to disrupt or fracture them, so you can lead a life as engaged as you were in intimate acts as you were without implants, for no fear of them being broken or disrupted during an act of intimacy. In general, touching and light touch with the right incision approach, like under the breast or through the armpit, and avoiding the areola, is going to maintain all sensation. So the risk of losing sensation following breast surgery nowadays is very, very uncommon. So even light touch intimacy, light touch arousal of the nipple-areolar complex or other areas of the breast will not lose their sensitivity for the most part after breast augmentation. It's a very, very personal decision to change one's figure, shape, and form, particularly the breast. And we've made great strides in modern approaches to plastic surgery to empower women to select the right size and shape for them, to have the kind of device that leaves you feeling completely natural and emancipated from that sense or tyranny of an implant, that you can feel that it's been integrated into your sense of self, and that the sensation and feeling both to your touch and others' touch is as natural as almost a natural breast would feel. And these elements have allowed women to be even more confident in making that important decision of whether or not to do breast augmentation. Again, Dr. Stephen Mulholland, Plastic Surgery Talk. If you found this delicate but important discussion and a short podcast around intimacy and breast augmentation, please share this with your friends on all your social channels, and we look forward to seeing you again on Plastic Surgery Talk for our next podcast.